Hello, my name is Brandon Ramacco, and today I'd like to show you how to evaluate for carpal tunnel syndrome, right? A compression peripheral neuropathy of the median nerve at the wrist or at the carpal tunnel. So ideally, you're using as high frequency probe as you have access to, a linear probe. But today, I'm going to actually use a Suresult D3 Ultra, which is a dual purpose probe, and it only goes up to 10 megahertz. Now, ideally, 12 megahertz is better, 15 megahertz is better, 18 megahertz is better, but use what you have. And I want to show that you can use a general purpose probe to diagnose carpal tunnel syndrome. So I've already applied gel to the transducer, and I have my patient in my preferred position. I find this position, if you can pull a table close by, or if you have a table in your office where the patient can just lay their arm down, that's best. Of course, this is such a quick and simple scan, you could just hold their arm and scan. So, which is what I typically do. It's so quick and easy. Okay, so I have things set up and we can go. I like to use sort of the presets, general musculoskeletal preset. Sometimes they're your unit. I'm not sure what unit you're using, may have a nerve preset. But even a general musculoskeletal preset should work. So as you can see from what we're seeing, there's a heck of a lot going on, right? And of course, you want to make sure your focus points are set correctly, the gain is set correctly, and depth is set correctly, so you can get as best a picture as you can. So I'm going back and forth here, and you'll see that there's so many structures, right? What the heck are we looking for? Well, as I tilt back and forth, things wink in and out of existence, right? This is an imaging artifact called anisotropy, and its tendons are more sensitive than nerves. Now in cross-section, a nerve and a tendon looks very similar, but since nerves are less sensitive to anisotropy, the structure which is more persistent is going to be the nerve. So as I go back and forth, you'll see that there's one thing that looks like a tendon, just like the other tendons, but it doesn't go black as I tilt back and forth, and that's going to be the nerve. So I can go back and forth a little bit proximal, a little bit distal, and I look for where that nerve is at its largest. Then I can pause, and I can get out my measurement tools. So if you were looking at the images, the structure that wasn't winking out in and out of existence is this structure here. So that's going to be our median nerve. So I can take our measurement tools, and I can either use an ellipse. An ellipse will typically work, or I can use a trace, and I can trace the shape of the nerve, and then I look at the cross-sectional area. If you use a threshold of 0.09 centimeters squared or 9 millimeters squared, that gives you almost 100% sensitivity, high 90s, 100% sensitivity, and around high 80s, low 90s specificity. So that will catch, or 100% sensitivity. That will basically catch all carpal tunnel syndrome. And it was just that quick and easy. Now, as I mentioned, the specificity isn't quite 100%. It's sort of hovering around 90% in the studies. If you want to improve your confidence, the larger it is, the more confident you can be in your diagnosis. So if instead of it just being a little over that 9 millimeter squared threshold, if it's 11 millimeters squared, 12 millimeters squared, 13 millimeters squared, then you can be more confident in your diagnosis, particularly if it's over 12 millimeters squared. Another finding is if you have the patient wiggle their fingers, you should see the nerve sort of wiggle back and forth. Of course, you should be practicing on normals. And if it doesn't wiggle, that can be another sign to improve your confidence in your diagnosis. The other thing you can do is you can sort of scan the nerve more proximal, maybe up until maybe about 10 centimeters more proximal, and you can compare that cross-sectional area. Nerve should only get smaller as you go more distal. But if the nerve has increased in size, that increases the likelihood of carpal tunnel syndrome. In particular, if the increase in size is larger than 40%, so a factor of 1.4. But even if you don't do those extra things, just using that cutoff of 9 millimeters squared, Again, has excellent power to rule out that condition, so you can start looking for other conditions. And did you see how quick and easy that was? So get practicing, get using your ultrasound, and best of luck helping your patients. Cheers.